I don't think I'm talking out of turn and saying psychiatry has had quite a controversial history in the past, and as a result some of those working now are having to sort of build bridges from what happened previously, and psychiatric genetics adds another layer of controversy perhaps, or unease in some parts. In addition to that, psychiatric genetics has been criticised in some quarters for not delivering in terms of its findings, and I think it's quite obvious that this is a very difficult area to research, and actually that developments and findings are going to come perhaps slower than perhaps was first predicted. And as much as the science itself is a very complex area, so is understanding people's attitudes towards psychiatry, mental health and psychiatric genetics. So in terms of the programme, we've been interested in certain social mechanisms such as stigma, such as understanding genetic risk, and stigma itself has become a sort of catch-all term. And coming from the social science that I do and interested in qualitative research, I want to kind of bring some nuance back to stigma, some of the fine detail, and I think being able to unpack the different types of stigma there are out there and the reasons why certain psychiatric genetics or psychiatric disorders, are stigmatized. I think getting to the roots of that is important to be able to tackle it and to perhaps destigmatize these disorders. I think there are possibly too many programs that go out there and try to destigmatize psychiatry and destigmatize mental health without realizing what those stigmas are in the first place. You have adverts now where mental health is being talked about, so I do think there was a period of time where perhaps that was hidden. So I do think that there are great strides happening at the moment in terms of having it on the agenda, as it were, you know, so that people speak about it and are willing to speak about it. I do think it needs to go a lot further, though. I think the fine detail isn't there, and when we talk of mental health, mental disorders, mental ill health, psychiatric genetics, we're talking about a wide spectrum of disorders and illnesses. The centre itself works on Alzheimer's, dementia, schizophrenia, bipolar, ADHD, autism, the list goes on. I mean, these are very different disorders in some ways. If they're not different in the laboratory, they're different in terms of how they manifest themselves, and they're different in terms of how people react to them and people's attitudes towards them. I mean, the work at the centre kind of shows that there are lots of kind of overlaps in sort of copy number variants and susceptibility genes in ADHD and autism, but I mean, I don't think I'm talking out of turn here in saying that people's public attitudes to those two disorders are completely different. People's understandings of what they are, the types of young people who might develop them are very different. So I think when we talk about mental health, I think often these great strides have been a more generic idea of mental health, often to do with depression or even things like feeling down. Okay, I think there needs to be a much greater interaction with particular disorders, and I think that's what the MRC Centre has the possibility to do, and I think that this is why, you know, part of this building is to connect the work done here at the centre with different groups. Now, that might be the general public, as it were, but it might also be mental health services, mental health groups as well. And I think one of the attempts of the centre is to kind of create a greater connection between their work, their laboratory work, their groundbreaking work, and then the work of other people working in mental health. Whether that's mental health services, whether that's GPs, whether that's in social services itself, and I think there's still some way to go in there, and I think there is a long way to go, really, to be honest, but I think people recognise that.